The first thing that I thought of when I saw this box was the box that Black women are forced into. Its sides try to define us, set limits on our personalities, and even restrict us from services such as healthcare. In some cases, this figurative box limits healthcare for Black women in a society where being a woman is already often dangerous. One of America's greatest undiscussed emergencies is the maternal mortality crisis. This is defined as death during pregnancy or up to 42 days after birth. However, pregnancy complications can create issues up to 1 year after giving birth, which we call pregnancy related deaths. In 2017, the US was one of 2 countries where the maternal mortality rate was actually rising. Compared to other developed countries, the United States has an abysmal death rate, over twice that of the rest. When looking at these statistics, it is easy to assume that being pregnant in the US is generally less safe than it is in many other nations. But in reality, that statistic is much more complicated. Geographic location, socioeconomic status, and, perhaps most notably, race, play huge roles in pregnancy risk. Pregnant Black women die at rates roughly 3 to 4 times higher than white women. Systematic social determinants such as little to no access to healthy food, safe water, safe neighborhoods, reliable transportation, good jobs, and good education significantly increase Black women's chances of pregnancy complications. While this means that Black women should be receiving especially excellent care, surveys have found that Black women are more likely to report disrespectful and unfair treatment due to race and little to no control during their delivery. Listening to pregnancy horror stories like those of Serena Williams is terrifying for Black women. This box that we're placed in is scary, dangerous, and even deadly at times. That's why I decided to come up with a solution. MyOB is my idea for an app designed to help solve the Black maternal mortality problem. Its purpose is for Black mothers to instantly connect with healthcare from anywhere, at any time of day, and to learn to advocate for themselves at their local clinics. Mothers can download the app at any time during preconception, pregnancy, or postpartum to receive advice and care. MyOB grants mothers the ease of digitally connecting with a physician in under 5 minutes, a unique feature yet to be seen in Teladoc apps. MyOB works pretty simply. After downloading the app, mothers will be prompted to fill out a brief medical history. They will then be taken to the app's homepage, which will feature a drop-down menu. One of the options on this menu will be the Direct Connect page. It will be here that mothers will have the option to hit the Connect Now button, which sends a request to an operator in a call center. The operator will pair this Direct Connect request with an on-call physician somewhere in the US. If the mother has worked with the physician in the past, that information is saved to her account and she'll have priority for being paired with that same physician if he or she is on call. The purpose of these physicians is to help these mothers with any of their symptoms and concerns, and to empower them by teaching them how to advocate for themselves with their local clinicians. If a mother still feels dismissed or ignored at her local clinic, the app physicians have the authority to call the clinic and discuss the mother's health issues, as well as her treatment concerns. MyOB's unique features place it above other solutions in a variety of ways. Its team of board-certified physicians and nurse practitioners would all be passionate about solving the Black maternal mortality crisis and eliminating bias in healthcare. The app's flexibility in allowing mothers to have an appointment at any time of day for however long they want allows for quick checkups during lunch breaks or after midnight shifts. And the lack of a physical clinic doesn't require mothers to seek transportation or childcare for older children. Lastly, MyOB emphasizes care all the way up to a year after pregnancy, when many complications that affect Black women at higher rates occur. While social changes such as increasing hospital care quality, the number of injured women, the amount of time spent in postpartum care, and the number of conditions caught early on have been attempted, they aren't working effectively, otherwise we would have seen a significant change. Social changes are much harder to execute, especially for complex problems with many causes, such as maternal mortality. This is why a concrete solution like MyOB can make a difference. If a solution like this existed in healthcare, we can start to break the box. It'll take a lot of hard work, but slowly we can start to take down its walls, deconstructing it piece by piece. With MyOB, the world won't need this box anymore. It'll start to treat Black women as equals, as women in the same amount of need for excellent healthcare. But until then, we have to stay strong. Because the truth is, right now, there is a box. We just have to remember, the box doesn't define us.